coming into the room. We'll get started in a moment. All right. Welcome everyone, and thank you for attending today's webinar on how to become a sales superstar during COVID-19. Just so you know that your mics have been turned off, and if you have any questions, feel free to click on the Q&A and send me your questions, and I will field them and ask them. I'll ask Albert throughout our presentation. For today's webinar, it will be recorded and a link will be provided to you via email after the presentation is over. So let's get started. I would like to introduce today's speaker, Albert Ho, who is a healthcare sales expert, and he has over 2 decades of experience and has owned a medical device business. I'm sure you've read his full bio during the registration process, and he's here to help share tools and tips to help you become better in sales. He is the author of the newly published book called Checkmate, How to Win the Sales Game in Healthcare. He's also the Chief Hero Officer of Healthcare Heroes. Let's welcome Albert Ho.
Thank you, Sandy, for that warm introduction. So this is our agenda for today, and hopefully everyone can see me and hear me okay. I always like to share a story of my first big sale. So in terms of selling products, you might be thinking, well, if you sell a $50 or $100 product, that you might find that challenging, but imagine having to sell a high ticket item. A couple years ago, I was involved with a medical device business where we sold CPAP machines. If you're not familiar with CPAP machines, that's why I've included a photo of what they are. It stands for continuous positive airway pressure. And these devices sell in different price packages ranging from $600 up to $1,200 because it includes the device and all the service for a few years. And this is the life-saving treatment, and that's what drew me to this particular business. So in opening an office, you know, all of the sort of background things, you know, finding an office space, hiring staff, signing a lease, and getting the equipment ready. But once we opened our doors, you know, customers are coming in, but not all of them were even getting this, were buying, you know, this product. And for the first 4 days, I still remember, there was not a single sale. So you can imagine how nervous I was being the business owner, right? We have rent to cover, we have staff to pay for, and I still remember on that 4th day was when a customer came in and we went through the whole setup. It takes about 1 hour for that appointment. And then we start going through each of those packages, right? We've got packages started at bronze, silver, and gold. And I was writing them down by hand so that they could see some of the different options. And after going through that, I paused and let that customer think about what package they wanted to get. The customer looked over the numbers and they were stroking their chin thinking, okay, well, what can they afford? If they have insurance, sometimes they might get a more expensive package. And after a few moments, the customer stood up, opened up his wallet, and gave me his credit card. And he said, Albert, I'm gonna get the gold package, $1,200. I still remember holding onto that credit card. I was so nervous, my hands were cold as I swiped it in the machine and then punched in those numbers, 1,200. After what seemed like an eternity, it said transmitted. And with a sigh of relief, I had made my first big sale. And with that, I always love sharing that story because that was the first of many sales. And over the course of several years, I'd sold well over $1 million worth of product. And I've since exited that particular business. But learning about that, and at that time, I wish there was a book that could help me. And that's one of the reasons why I wrote this particular book, because I believe that you have what it takes within you. Sales is a skill that can be learned. And with practice, you can become better. I'll pass things back to Sandy.
Great, thank you, Albert, so much for sharing that personal story. I know that when it comes to sales, it can be so nerve-wracking just starting off your career, and it just takes that first step to build your confidence over time and to understand that you are making a difference in a person's life and improving their health. Now I'd like to get to know other participants better, and I am going to launch a poll here. And we would kindly ask that each of you answer these two questions. The first question is, what is your sales level experience based on the number of years? And then the second question is, what type of customers do you sell to? And we have different categories for you to choose from. So we'll just wait a few moments as the numbers are coming in. It looks like we've got some participation here. Hopefully the rest of you can also review and submit your answers here. And that way, this will help Albert to tailor his presentation for today. Okay, so just a few more moments for you guys to put in your answers. All right, so I'm just going to wrap up the poll. And here are the results.
Okay. Some novice, some experts, some are direct to consumer, some agents. Okay. Gives you a bit of a sense. Thank you everyone for participating. So let's move on to our first teaching for today. And thank you everyone for joining us. I really appreciate you guys all taking the time to become better, because it's one of those things that, if you don't put in the time and effort, you're not going to get better. And when I come across people that say, oh, I'm not good in sales, or I hate selling, I felt those exact same things as well in the past. And with a framework, I believe that anyone can become better in sales, because no one was really born to be in sales. I think it is a learned skill, because it is a matter of solving problems. And here you see the hero sales method that I've developed over the years. It's available for download over my website, and I have given this talk numerous times. So if you haven't seen it yet, I do have a 45-minute seminar of this particular sales method on my YouTube channel. You can just search for Albert Ho, and I'll quickly just go through it. It's sort of a 5-step process, and you kind of go through each step to acquire customers. So the first is prospecting. So how you look for customers in terms of qualifying them and finding them. That's why I have those. It's like a binocular. That's you're looking for those customers. Once you find that customer, the second step is establishing trust. How are you going to get them to know, like, and trust you? Whether it's through a virtual method, or it could be face-to-face. Once you've established that trust, the third step is listening to their needs, desires, and problems. Once you understand their problems, then you can potentially offer some solutions. And once you offer those solutions, then it's a matter of closing the sale. Asking for that sale is that last key step, because once you get through all that, it's up to you as the salesperson to really say, well, what's stopping you? What is it about your product solution that they are not buying? And once you do that, you have that 5-step process. Okay. Let's move on to our first teaching for today, which is how COVID is affecting pharma sales. So this may not apply directly to what the type of customers that you are working with, but I hope that it will still give you some insights, because COVID certainly came unexpectedly, and no one knew how it would affect our city and the entire world. So this particular graph would be useful for people that are in pharma sales, that sell to physicians. And what you can see here is there was a recent survey done by Ipsos Reid in 2020. Basically, they surveyed roughly 300 physicians and specialists. And based on the numbers, you can see pre-COVID is the dark blue line, and then now is the greenish line. You can see a drop in those numbers. So There's various drops across the different specialties, but you could say on average between 50% to 80% reduction in patient volume. So they are still seeing patients, but they're going to be seeing them in a different way. So that will touch into our second point afterwards. So that's something definitely to keep in mind if you are trying to reach this particular customer group. Next, let's move on to some of the changes that have occurred. So this was also kind of a mystery, right? Before this survey came out, we didn't really know how these offices were changing. For example, some visits were being postponed, some staff were being laid off, there were reduction in all of these parts of their practice, in particular even testing for COVID-19, right? You know, now they have to test patients for this. But the one thing that was definitely a big eye-opener and definitely want to share today is taking patient visits using telemedicine. So that is something that, you know, telemedicine has been around for a long time, but it's only now during COVID that has really dramatically increased. So that's what I kind of want to share with you today, is that you can also use virtual tools to increase how you reach your customers, whatever they may be, okay? So now when you've thought about these changes due to COVID, I want you to think about what has happened during this period, right? What's been your biggest challenge? And Sandy, could I have 1 minute? And this is a chance for you to think about it and write that problem down, please. Okay, hopefully you've written down something about what's been your biggest challenge. And now, you know, we're amongst friends here. I know that some of you are strangers, but I want you to think that you're at a campfire and you're sharing. I want you to be comfortable sharing your answers. So if I could have any volunteers raise their hand, and Sandy can actually turn on your video so that we can actually hear firsthand some of these problems. Is there anyone willing to share? No? They're shy. Okay, well, if this is your chance, but it's okay. We there's no one that's willing to. That's okay. We can move on. Just raise your hand, and we'll actually turn on your audio and video so that you can talk about it in your own words. Okay, that's all right. We will move on to our hot seat. I mean, so now that you know that you have a taste of what problems have been coming up, is there anyone that would like to get some one-on-one time to talk about their problems that they're facing? Is there anyone that would be willing to share? We call this the hot seat. Okay, that's all right. It's a missed opportunity, but there'll be other opportunities in the future. That's okay. Let's move on to our second teaching for today. So this is the rise of video conferencing. So I'm sure that everyone has been getting used to using some of these virtual tools. Like, prior to COVID, I wasn't really doing webinars yet. I was doing mainly face-to-face kind of speeches and presentations. And what I found is that, video conferencing has become a key component in terms of how people, connect with their customers. So in terms of how this affects the particular niche that I work with, so pharma sales reps and medical device reps, there has been a dramatic decline in face-to-face meetings. So prior to COVID, physicians were seeing 19 pharma reps per month, and now this is reduced to only 1. So if that was the primary way that you were connecting with physicians, you're going to have a different strategy now, right? Because of the fears and risks. I mean, things are going to be hopefully starting to change over the next little while as things open up, but I would say that you do need to have this particular tool in your toolbox so that you're more comfortable. Okay. So that you have the particular tools to continue with selling. And a particular thing to note is that 62% of physicians will now allow telephone or video visits with pharma reps. So if you haven't used this tool yet, this is a great time to start using it. And I do want to mention two particular tools that I've learned about. So OTN is called Ontario Telemedicine Network. So this is a provincial agency that has provided this to physicians for a long time. And, you know, there has been some use of it over the years. And during COVID, there has been a dramatic use in OTN, but it wasn't as user-friendly. Sometimes there's specific softwares to download and then specific logins on the physician side as well as the patient side. So you likely have not come across it before, but there has been a dramatic use in Zoom. So Zoom actually does have several versions. I'm sure you've heard in the media, oh, there's Zoom bombing, Zoom's unsafe. But Zoom does have several versions that are safe for patient visits. And I've seen a very dramatic use of this in primary care physicians as well as in hospitals. So I've personally been involved in projects where the enterprise version of Zoom is being rapidly deployed across organizations. And that's sort of been the choice of physicians to use in conducting visits with patients, because patients were, you know, some types of visits were stopped so that they couldn't come in person to hospital, but you could continue them either by telephone or by Zoom. So Zoom has become a primary video conferencing tool that you definitely need to get comfortable with if you haven't started using it yet. So if you had to think about, you know, video conferencing, I want you to think about, you know, do you plan to use virtual tools to reach customers? So Sandy, if I could have 1 minute and people to think about that question. Okay, thank you for that. Hopefully everyone has thought about if they plan to use virtual tools. So now this is also a chance for people to share directly. If anyone's willing to volunteer, just raise your hand, and through the Q&A, you can, I'd love to hear answers directly from you guys. Comfortable? No, everyone's shy today? All right, that's okay. There will be a further chance for Q&A later on. So let's move on to a personal story for me. And I always love to sort of end with this, is that, you know, growing up, I used to be someone that loved to sleep. Anytime, anywhere, I could fall asleep. And when I was even in high school and in university, I would notice that no matter what time of the class, even if I just got a good night of sleep, it was bright and early, 8 in the morning, within 15 minutes, I would be fast asleep. And the professor must have been thinking, what the heck, why is Albert falling asleep all the time? I even got a sleep test when I was 17. And if you don't know what a sleep test is, you sleep overnight in a lab, and they attach a bunch of electrodes to your head, and they basically monitor your sleep overnight. And the doctors reviewed that report, that sleep test, and the results came back negative. There was nothing wrong with my sleep. So I thought, okay, I guess I just must be, tired all the time, and I kind of continued going through life like that. And heading into university, the same thing would happen. I would always be falling asleep within 15 minutes of any lecture. I even thought, okay, well, I don't want to fall asleep. I want to make a good impression when I'm in university. I'm going to sit right up in the front row. And guess what happened? The same thing. I would be fast asleep within 15 minutes. So I repeated that sleep test at the age of 28. Same thing. I would sleep overnight in the lab. They would put electrodes on my head. And after that sleep test, the results came back and the doctor said, negative. There's nothing wrong with my sleep. So I thought, what the heck? They haven't found anything wrong. Okay, so I continued going through life and I still noticed I was able to fall asleep anytime, anywhere. When I was, in class, sometimes even talking to people during exams. There's one time in 2014 when I was driving to Waterloo, which is about an hour and a half away. I was heading there to visit some friends. It was 8 o'clock at night and it was dark. So the sun had already set. And at the 30-minute mark, I started to become sleepy. And I could feel myself drifting across that median. And it's just a double solid line. So nothing to stop me from, potentially veering into oncoming traffic. Honk! I suddenly froze, wide awake, and all I could see was oncoming headlights. I quickly pulled over to the side of the road and I took a deep breath. I had almost gotten hit by a car. It's that night that I realized something is wrong with my sleep. So I got another sleep test, a third sleep test. But in addition to the nighttime sleep test, they added in something called a daytime sleep test, which means after a good night of sleep, the technician would try and see if you could fall asleep. So this would occur, let's say at 7 o'clock, 8 o'clock, 9 o'clock in the morning. And you know what happened each time? I was able to fall asleep. I was even telling him, hey, I've got a special talent. I can fall asleep anytime, anywhere. And that's when the doctors figured out that I have idiopathic hypersomnolence. It's kind of like a narcolepsy where I can fall asleep too easily. And it's normally not even caught by a nighttime sleep test. It's only caught by a daytime sleep test. So it was just a couple of years ago in 2014 that I was finally diagnosed. With that, my life has completely changed. I now have a special medication that I take to keep me awake. And that's what made me so passionate about that particular sleep business, because I was literally changing people's lives. If I hadn't learned about that particular sleep test and being diagnosed and found this medication, I never would have had the life that I have now. So hopefully this has inspired you to continue doing what you're doing. My passion is in healthcare sales, but even if you're selling to something kind of related, I truly believe that you have the skills and the knowledge to become better in sales, because your patients are counting on you. They really need what you're able to offer to them, and so that you can hopefully solve their problem. So now I'd like to talk a little bit about some of the other services that I have to offer. So in terms of one-on-one coaching, I've been doing this for a couple of years. So this is my 9-step framework. So the first 3 kind of steps at the bottom are the preparation steps, where I go through the mindset, the tools, and the theory in terms of selling. So if you have no formal sales experience, I want to share my knowledge with you. And the second step is the implementation. So I talked about the hero sales method, which is my tried and true method. And then you get into the planning, right? How are you actually going to reach out to those customers, and in terms of goal setting? How many customers are you going to reach per week, per month, and try and reach those goals. And then the third step is the performance, right? So I'll actually take the time to go through and listen in on your sales pitches. I want to help you measure your own success and optimize you to set you up for success. I've been asked before what my superpower is, and I believe that my superpower is to get you from no sales experience to a successful career. And I even want to, if you haven't earned a six-figure income yet from sales, I want to get you to that point and within 1 year. So that's why I offer this particular program for you, where I do this one-on-one with just one person at a time. There's unlimited email coaching, live telephone support, and you have access to all of my resources, webinars, and events that I go to, and that I host as well. So the retail price for this is $3,999 for 1 year. But today, because you're hearing this from me, and I want to be able to offer this to you, I can offer this at a discounted price for $1,999 for 1 year. So that's if you sign up today. So please stay on the webinar afterwards if you'd like more information about that. So if you don't feel that this is right for you, I also do have group coaching available. So group coaching is just with, I have all of the same elements, except it's with a group. So up to 6 people. We have monthly coaching calls where we'll actually hear direct from you on your particular problems, so that I actually want to offer something specific to help you overcome the challenges that you're facing. I've got unlimited email coaching still, and the retail price for this is $499 for a year. And because you're on this webinar today, I can offer for $299 for 1 year if you sign up today. So those are the two primary programs that I offer. And with that, I think we are ready for Q&A. So this is your chance to ask any last burning questions that I haven't been able to answer so far. You can answer them, and Sandy will try and filter those.
So for those of you who have any questions for Albert, you feel free to open up the Q&A at the bottom of your panel, and feel free to send over any questions you may have. Looks like it's a shy audience today. That's totally fine. So we'll just move on to the next part. All right, so as a thank you and a token appreciation for attending today's webinar, Albert would love to be able to send you a digital copy of his newly released book, Checkmate, How to Win the Sales Game in Healthcare. And be sure to sign up for his mailing list if you haven't already registered for it. That way you can get the latest scoop on his webinars, events, and any great healthcare strategies that he will be offering. And here are many testimonials that Albert has received based on his book. And as you can see, from international best-selling authors to people who are also in the healthcare space and entrepreneurs, they absolutely love reading his book. And just one last thing is that we'd like to share a special message from Gerry Robert. He is an international best-selling author, and he's spoken on stage with Tony Robbins.
Publisher of Black Card Books, and I'm so proud to announce the publication of Albert Ho's book, Checkmate, How to Win the Sales Game in Healthcare. And if you're in pharmaceuticals, if you're in medical devices, if you're in the healthcare industry, you have got to get a copy of this book. And I can't believe how timely, it just came out this week, right in the middle of the coronavirus pandemic. And it is going to prepare people in the pharmaceutical industry and other industries on how to sort of maximize sales and marketing during these times. Listen to, from the table of content, some of the things that Albert covers in this book, which is so timely. If you're in that industry, this is a phenomenal opportunity for you to learn and grow and build your skills now more than ever. How to become a sales superstar, chapter 1. Chapter 2, the perfect prescription to sell physicians. 3, beating the bureaucracy to sell hospitals. 4, how to sell directly to consumers. 5, retirement home selling doesn't have to take a lifetime. Retirement home selling doesn't have to take a lifetime. Next, how to cut the red tape to sell governments, how to sell to multinationals, how to get venture capital funding, how to become a unicorn startup, how to sell in the cannabis industry. Hey, listen, if you want to learn from one of the top thought leaders in the world, this book will give you a roadmap. It's a game changer today. If you are in charge of a team of people in that industry, get a copy for everybody on your team. It's going to show them the new way to sell in this new environment. And Albert, I want to congratulate you on this. You've done a fabulous job. It's an easy read. It's very practical. And we suggest you get your copy right away.
All right, so I hope you enjoyed that special message from Gerry Robert. And by purchasing a physical copy of this book, you will receive additional support, which includes a one-on-one consultation with Albert. It will be personally autographed and it will include free shipping. And in addition, Albert is so proud to be partnering with Prostate Cancer Canada. And for every book purchase, $2 will be donated towards this charity to help with combating prostate cancer. And we do have a special promo code. And so for those of you who are on this webinar, the retail price for this book is $32.99 plus tax. But for today, if you use the promo code Checkmate, you will be able to receive it for only $20. So be sure to get a copy, and for those who who can benefit from Albert's book. And don't forget to stay in touch with Albert through social media, whether it's through Facebook, Twitter, or Instagram, and to be able to keep in touch, and feel free to send him a message or any questions. He'll be more than happy to help answer your questions. All right, well, we'll see you next month, and thanks guys for joining today's webinar.
Thanks everyone for joining.